Good afternoon, and welcome to Mercy Health Muskegon's Healthcare Spotlight. This is your host, Katie. Each week, Mercy Health will bring you important and helpful information that guides you in becoming more informed and more involved in your healthcare decisions. Carefully listening to you and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or. It's all of these and more. It's Mercy Health. Today, we're talking about pharmacies with our local experts, Lisa Smith, PharmD, Joe Graftma, PharmD, and Tara Spiebel, Manager of Pharmacy. Let's dive into some information about the pharmacy options here in Muskegon at Mercy Health. So today's healthcare team includes a lot of people with new titles and new roles. Tara, how has the role of the pharmacist changed during the last decade or so?
Traditionally, in the past, pharmacists used to be behind the counter doing most of just dispensing. You never really saw them out front. This has changed. The pharmacist is out front and center. We do a lot of counseling. We really are the most accessible healthcare professional. You don't have to make an appointment to come see us.
Very cool. And are today's pharmacists trained and are they educated differently than the pharmacists who went to school back 20, 30 years ago?
Yes, they are. It's actually a doctorate program now. It used to be a bachelor's degree where we get more clinical education than we used to.
Okay. And is there any kind of any extra education or any extra training that is required now that you are more face-to-face with patients?
Yeah, it's that doctorate degree. So it's actually you do 2 years of undergrad and then 4 years of the doctorate school.
What types of services does a typical pharmacy offer now that they weren't offered when our adult listeners were growing up?
Pharmacists are able to do more now. We can do immunizations, such as the flu vaccine, Zostavax, which is for shingles, pneumonia vaccines, those sort of things. We can also do more counseling. We can do what's called complete medication reviews with patients, sit down one-on-one for an hour to discuss medications, see if there's anything that can be improved with their medications or see if we can decrease their costs of meds, those sort of things.
So a complete medicine review, is that something that a patient would have to call ahead or schedule for?
Yes, that is something that we usually do schedule for since it is about an hour out of the day.
Okay. And then how do people go about scheduling for that?
We actually reach out to a lot of our patients on those sorts of things. We get from the insurance company, we get an alert that says that they are eligible for these sort of services so that we can sit down and talk to them.
Oh, great. So it's like a proactive approach then.
Yes. Yep.
Oh, wonderful. And talk about just beyond the pharmacist, who are some of the other members of the pharmacy team? Who is all on that team?
There are pharmacy technicians, which really are the heart of a pharmacy. Pharmacy cannot run without our pharmacy technicians. We have a few billing experts, but they are also pharmacy technicians. So really, it's just the pharmacy technicians and the pharmacist.
What does a pharmacist or pharmacy technician, what are they qualified to do?
They can do the billing, so run it through your insurance. They can fill the prescription, run the prescription. They do reach out to patients to set up those complete medication reviews, but it is the pharmacist's job to complete those.
Okay. And then, so Lisa, we have some other interesting news about Mercy Health Muskegon. So they are currently in the process of receiving accreditation as a specialty pharmacy. So for the average consumer, what does a specialty pharmacy mean for them?
That's a great question. A lot of drugs that are coming to the market now have a lot more precautions than a traditional medication does, and so that requires a lot more follow-up. And while we do dispense a medication like a normal pharmacy would, we take a little bit different approach where we proactively fill it, where we call patients ahead of when they would need it and check in with them, see if they have any side effects, see if they have any problems taking their medication. With these medications, it's imperative that they take that dose every day or twice a day as they need to make sure that they're getting the proper treatment and that it's doing the job that it's supposed to be doing.
Wow, great. So I hear that proactive approach then for patients to fill prescriptions.
Yes.
That is wonderful. So is there more than just one pharmacy that's going through the process of becoming a specialty pharmacy?
Nope, just for our pharmacy, it's the Hackley Professional Pharmacy that's on Leahy is going through this process, and we serve as the hub for Mercy Health Muskegon.
Oh, wonderful. And so as the hub, what do you mean? Can you describe that?
That's where we are located at. So that's where myself and the technicians and other pharmacists, that's where we do the magic. That's where it all happens.
Oh, wonderful. And where are some of the other Mercy Health pharmacies located?
We have the one on Leahy, Hackley Professional Pharmacy. We have one on West Shore. We have one on Fisherman that's called West Shore Pharmacy. We have one at the Lakes campus, and we have Glenside Pharmacy, which is also on Sherman further down.
Can patients access the specialty medications from any Mercy Health pharmacy location?
They mainly come through us. I mean, we can make arrangements to have it go to another pharmacy, but one of the great services we offer is that we deliver these medications to their home by a person, or we send them in the mail for the patients that are in Oceana or Ottawa counties that it's not very accessible to get to us every month as they need to.
Oh, wow, that's great. So people don't have to come to the pharmacy. They can have it at their convenience delivered to them.
Correct. And that's part of what we do to make sure that they're getting that medication when they need to.
Wow, that sounds wonderful. And I'm sure that's changed. That's different over the past, few years too, from what pharmacies used to do. Is that a dramatic change in the way pharmacies work?
It is a dramatic change for us, yes. And we provide that service at no additional cost to the patient. It's just what we do to make sure that they're adhering to therapy.
Wonderful. Is it kind of like the phrase, a stitch in time saves 9? Is it much easier to keep patients healthy by staying on their medicine and keeping them in their routine?
Exactly right.
Okay. And then, so another, is there anything else you'd like to mention about the specialty pharmacy? Anything anyone should know about that?
No, I think we covered it.
Okay. So we'll move on now to it's called the Meds to Go program. So can you explain to me, Tara, what the Meds to Go program is?
Our Meds to Go program runs out of Hackley Professional Pharmacy, which is the one that was just mentioned on Leahy. And we also have a new pharmacy that is in the basement level of Mercy Hospital. That one is not accessible to the public right now, but we do provide Meds to Go services out of that pharmacy. Meds to Go is meds to the bedside prior to discharge from the hospital. So we will get the medications ready, send them up to the room, counsel patients if they want counseling. We also do some medications for the emergency room patients who are also discharged.
And I can speak to that a little bit more because I do work at Hackley, a mom that just had a baby that, the first-time parents don't want to go to their normal pharmacy and wait to get a prescription filled, or for the parents that bring their child in to get their tonsils taken out. We will have that medication to them before they even walk out of the doors. It's just a great service that we provide.
Wow, that's wonderful. Once again, it's that proactive approach and getting the people the medications they need
Correct.
When they need them and not delaying. That's wonderful. So is this Meds to Go program, is that just an inpatient program? Is that for people who are in the hospital?
Yes. Yep.
And is it just for certain floors or certain departments, or is it pretty much house-wide for everyone who is a patient at Mercy Health in Muskegon?
It's house-wide, and we do it for just patients that come in for just one surgical procedure or patients that have been in the hospital for a month. We will do it for all patients.
Okay, and that's at both Hackley and Mercy campus?
Yes.
Wonderful. So do these medications that are given to patients in this program, do they still go through insurance?
Yes, they would run like any other normal prescription from any other pharmacy. They do go through the insurance. They're just delivered to the bedside.
And do these medications, do they cost more than if you were to pick them up yourself?
Nope, not at all. No difference.
And so what is the response from patients and families? I know we had that story about the new parent. So, I mean, what's kind of some of the emotive responses that we've gotten from people?
Just along that lines, they're just thankful that they don't have to make additional stops on their way home or wait additional time when all they really want to do is get their loved one, their family member, their kid, whomever, home and in their comfort zone.
And do we have any data on how many people have participated in this program, or about the percentage of inpatients who do participate?
We do. At the Hackley campus, we fill between 300 and 400 prescriptions a month that we deliver out. So, a couple prescriptions per patient. We're looking at about 100, 150 patients a month.
Oh, wow. That's wonderful. And so, and have you seen that? Do we do any data tracking on if you find that people get the meds to go at the bedside? What do they adhere to their medication better than people who don't get this meds to go program? Is there any data to support that?
Unfortunately, no, not at this time. A lot of these patients that we see, might not be our normal patients. They go to various pharmacies of their choosing, and so we just see them that one time. Our role really is to make sure that before they leave, they have what they need.
And you made mention of having pharmacists go and do bedside counsel. So it's another aspect that a pharmacist offers to that. You would typically think of as an additional step of your primary care doctor or a hospitalist might do. Instead, it's a pharmacist. So tell me more about that, Lisa.
So when we do deliver, whether it be a technician, they'll make sure that they have asked if the patient has any questions. And if they do, a pharmacist will go upstairs and address those questions before we leave. Or if it is a pharmacist that goes up there, we, go through and make sure, this will be taken once a day. This will be taken twice a day. Make sure to take this with the food to help prevent an upset stomach or, whatever the medication would call for.
Okay, great. What are some typical questions or, that people would have to ask their pharmacist for this Meds to Go program?
How should I take it? I had a dose in the hospital. When should I take my next dose? What should I keep it in the refrigerator? Should I keep it in my bathroom counter?
Okay, so there's lots of different variations because every medication, every patient experience is different.
Yes.
So that's cool. So how long have you guys had the Meds to Go program? Has it been a couple years? Has it been a few months? Or
Nope, it's been a couple years, and every month it continues to grow as word of mouth spreads from good customer, great customer experience.
Yeah. Oh. At the Hackley campus, we've had it for several years. At the Mercy campus, it just started in February.
Oh, wow. So it's fairly new there. But that's exciting that people can, go there and expect that now at both campuses. That's great. So was it spurred by the successes at the Hackley campus, and that's why it was brought over to the Mercy campus then?
So from an inpatient perspective, everybody loves the Meds to Go program. So like Lisa and Tara said, patients get the medications before they go home, and more importantly, the providers, so the physicians, the doctors, the social workers know if the medications are covered before the patient goes home as well. Unfortunately, I've had some conversations with patients where they're given this medication on discharge, and they have to take it, right? If the doctor's given it to them, they wouldn't give it to them if it wasn't important. They go to the pharmacy, and it's $500 or $600. So there they are. It's 6 or 7 o'clock at night. Their doctor's office isn't open, and they're trying to call back to the hospital to try to figure out if this medication is covered and try to figure out if they need to spend that type of money to try to get this medication. I think that's one of the biggest benefits of this program is that before the patient leaves, they know what the copay is. They pay the copay. They have the medication. So like Lisa and Tara said, they don't have to, you've already spent all this time either in the emergency room or in the hospital. You don't want to make one more stop. So to have that medication, to have it paid for, to know what it is, to not have that stress, and not have that worry once you're discharged, it's a win-win for everybody. The patient loves it for all those reasons, and then the social workers and the docs like it for those same reasons. They're not getting the calls back after hours, and ultimately the patients are taken better care of because they're getting that medication right up front.
Great.
Because even though there's not, especially on the primary care side, there may not be as much evidence, but they have looked at studies with people getting antibiotics from the emergency room. If you actually give them the antibiotics before they leave, there's less return visits because they're more likely to actually take the medication because they don't have to take one extra step to get it. They have it when they leave. So it's a wonderful program.
That's great. And for people who have, mobility issues, transportation issues, that extra step to the pharmacy could really be a deterrent for them. So it's great that we help and take care of that, before they even leave the hospital. So
absolutely.
That's wonderful. And that's great to hear that it's a satisfier for the staff and the physicians as well, that people are, this is a product that makes everyone happy.
So it went so well. We had to work through some regulatory issues before we could get the pharmacy set up at the Mercy campus. The social workers primarily were clamoring for this because of the success of this at the Hackley campus. They knew how it worked. They knew the benefits that the patients had. So they kept asking, when are we getting this? What's going on? What's the next step? So they were very happy. Everyone was so happy when this finally opened in February.
Great. It sounds, and it's gone very well there at the Mercy campus.
Yeah, very well received.
Very cool. And so we're going to switch gears a little bit and talk about a very important event that we have coming up next week, Saturday. Twice a year, we have a drug take-back event called the Muskegon Area Medication Disposal Program. And this is sponsored by Mercy Health and other community organizations. So this next event is Saturday, April 29th, from 9 a.m. to 1 p.m. at Norton Shores Fire Department, which is located at 1100 East Pontaluna Road, Muskegon. So tell us about this event and what it offers to our community.
So this is a great community event. This has been in place for about 7 years. We've been doing this event. Over the last few years, because of some of the other advances that we made with some of the daily take-back programs, we've been able to reduce that event, or the number of events where we just do them twice a year, typically once in the spring and once in the fall. It's really a time for the community, for everyone in the community, to get those unwanted medications out of their home. This could be something that's expired, that could have been someone that a loved one had, or just something that you don't need anymore. Your doctor switched your regimen, switch your medications, and you don't need to take it anymore. This could be prescriptions. This could be over-the-counter products. Really, any type of medication that you would take that you don't need anymore. We really encourage people to come to the event and get rid of those medications, clean out your counter. And they can bring back, like I said, the prescription stuff, the over-the-counter stuff, creams, lotions. Again, if it's a medication of some sort that they purchased at a pharmacy, bring it back. If you're not using it anymore, bring it back to us.
So you mentioned, can people bring sharps?
Yeah, at this event, they can bring back sharps as well. What we ask for that is that we obviously don't want just the needles. We don't want anyone to get potentially accidentally stuck with a needle. So what we ask is either in the red sharps containers that you can have, but if some people don't have the sharps containers, we've also had folks bring them back in either coffee cans or detergent bottles, just a heavier grade plastic, and then tape that up really good just to make sure there is no chance for someone getting accidentally stuck with a used needle.
Okay. And then what about illicit drugs or illegal drugs? Can people bring those in as well? Sure.
So one of the beauties of this event, we have worked in law enforcement, and we actually had some of those conversations right away. Everyone was in agreement around the table that if we could get something out of the environment, and by the environment, just the community, we would do it. So really, this has really been from the beginning and moving forward, no questions asked. So if anybody has anything, prescription, non-prescription, illicit, illegal, if they want to get rid of it, we'll take it back. No questions asked.
Great. And so why is it important for in your household or for a family to not have these substances, like the controlled substances, especially we hear a lot about opioid use and abuse. Why is it so important to get that stuff out of your cabinets, like the Vicodin you got from when you had teeth extracted or, a root canal done? And, why is that so important for folks?
Sure. So when I think of this, there's really a few reasons why it's so important. Starting with the one that you mentioned, the controlled substances. Unfortunately, if they're in your house and you no longer need them, that's an opportunity for someone else to try and get it. As much as we'd like to think that no one would just want to take that, unfortunately, many of these drugs are used improperly, are abused. So by having that medication in your house when you know you don't need it, that opens up the potential for having unwanted attention for that medication. But further, moving into some of the other reasons, for one, it just we all have that cabinet that has all this stuff in it. So by getting rid of it, it gets rid of that clutter, it gets rid of those. But more importantly, for the rest of the members of the household, it eliminates the potential for having them take it accidentally. I just talked to someone from the community where they had left, thankfully it was only an over-the-counter product, but had left it on the counter for what they felt was a matter of seconds while they went to get a glass of water. They came back and that over-the-counter medication was gone. The only thing, but there was a little tyke running around who was old enough and tall enough to get the counter, and that's the only thing that this person could think of was that in those few seconds, that little tyke grabbed it and took it. And thankfully, again, it was just something over the counter, so the child was fine. But if you talk about some of the opioids or even a lot of the prescription medications, the adult dose for a lot of the prescription medications is so much more than a child would need. So it gets rid of that potential for someone accidentally taking that as well.
Oh, great. And especially you think too, some antibiotics, because I know sometimes people don't take them as they should, and I see some smiles around the room. So is there anything you'd like to mention about antibiotics? Like if you should take them for the full course, but if you don't, then should you just give them Joe's got a sore throat, let's give him these antibiotics to help him out? I mean, what are some of the dangers in taking other people's prescribed antibiotics?
Sure, that's a great point. And the smiles come from a pharmacist's pet peeve, is what you hit on right there. I would argue that there should be no leftover antibiotics. If the doctor gave you 5, 7, 10 days, however much they gave you, that's how much you're supposed to take. A lot of times you start feeling better within 2 or 3 days, but the infection doesn't get you don't eliminate the total infection unless you take it for however long the doctor gives it for you for. So the dangers in that, I think that's a great point about prescription medications in general. So many people are taking prescription medications nowadays that it's a lot more commonplace that, well, if it worked for you, it works for me. The point that's often missed is the fact that, the doctor doesn't just this should work. They very specifically and very methodically say that, okay, based on your age, based on how your kidneys are working, based on how your liver is working, based on the other medications that you're taking, this is the most appropriate medication for you. We're all different. We're all different ages. We all take different medications. So that's not necessarily always true. So just to say that just because something works well for me, that it's going to be the same medication that the doctor would prescribe for Tara or Lisa or anyone else, that just isn't so. So there's a lot of danger because medications do interact. And that's why it's important to make sure that your doctors, your pharmacists, make sure everybody know about every medication that you're taking. And really think of the fact that the medication, this truly was selected for you. These aren't a one-size-fits-all that anybody can take this. Now, oftentimes people are prescribed similar medications, but that's not saying that you can just, without asking, just do that.
And so also too, so a lot of people think, if I just have leftover medications, I'll just dump it down the toilet or throw it in the trash. Why would that be a bad idea for the environment? Let's get back to environmental factors.
Sure. No, that's another good reason, and one of the other major prongs of why we even started this. So a lot of the medications that we use can actually be harmful to the environment. So a lot of the wildlife, fish, and other animals are very sensitive to some of those medications. Some of the medications, some of the hormone replacement therapies that people take can actually really wreak havoc on some of the fisheries. They've even shown where it changes the reproductive health of these fish. And even more so, we were talking about the controlled substances earlier. If those were thrown in the trash, animals have died. Because they've gotten into the trash. Dogs get in the trash. So if the medications were in there and they took those medicines and they swallowed those medicines, again, a human prescription isn't necessarily the same as a animal prescription. So animals have passed away, unfortunately, because they've accidentally, taken medications that were just designed to be thrown away.
Oh, wow. So for this drug take-back event on Saturday, April 29th, do they have to complete any paperwork or identify themselves when they drop the medications off?
Sure. So when so how the event works, it's really kind of neat how it's set up. It's really set up. We partner with the fire departments. We actually have police officers there as well. It's really set up as a drive-through. So what we do is there's a line of cars. We bring typically 3 or 4 cars into the one of the fire bays, and then there's volunteers who will come and take the medications from the car, and then take them to the collection area where the pharmacy. We actually have some people from our pharmacies come and help with these events. Basically, we put them into different classifications. One of the things we like to do that we give back is some of the data to the doctor's offices and just to the communities, as far as what types of medications we're taking back, how many medications we're taking back, that sort of thing. So the patients drive in, and then they are asked to fill out a brief survey. No names, nothing like that. We just want to know where the people are that we're helping, that we're serving. So it's, how did you hear about it? What zip code do you live in?
Okay.
So we know what aspects of the community that we're helping with.
Okay, so it's not to identify them, but rather to identify just a demographic, just a purposes. Okay.
And I wanted to say, if you can't get to this event on Saturday, our retail pharmacies, any business day that we're open, we will take back these medications for you and store them and bring them to the event. So you don't have to wait for that twice a year event. You can at any time get them out of your house and get them out of your possession and bring them to us.
That's a great point to make. Joe had talked about the daily take back event. So that's what you're saying, that each pharmacy you have that people can bring their prescriptions instead of waiting for 4 months to have a Vicodin hanging around your house or
Correct.
something.
Yep.
Oh, wonderful. And so how successful has this event been in the past, this drug take back event?
It's been hugely successful, very well received in the community. Since its inception over these 7 years, we've taken back over 20,000 pounds worth of medications. So been very well received, and that's between the community events that we talked about, the daily take back events, and someplace else people can take back their medications if they feel more comfortable, are actually the local police departments. So mainly controlled substances. That was the main reason why those boxes were put in place. But pretty much every police station within the Muskegon County has one of these boxes as well. So medications can be dropped off there as well.
So what kind of information should people remove? I know those sticky tabs are really hard to get off. Those labels are really hard to get off your prescription. So what kind of information should people try to get off?
At the event, we've really had all types brought back. Where people will just give us the vials. These do get disposed of. Believe it or not, these actually get incinerated. Incinerating them is actually may not be. It's more environmentally friendly than just flushing them down the toilet, that type of thing. So anything that is on there gets fully burned up, and actually there may be some electricity that's generated as a result of that too. So that's so there is a little bit of green aspect there as well. But folks have just kind of taken a Sharpie, blacked the names off of the vials. We've gotten just Ziploc bags full of medications, or people have just brought us the vials. So they can bring them in whichever way, shape, or form that they want for us to take care of. And
so it's just going to be professional people handling these medications. It's not going to be anybody. I mean, we all have to adhere to HIPAA and things like that too. So there's.
Yep. So from the pharmacy perspective, basically they drop it off. Most times it's in a bag of some sort. They'll, one of the plastic grocery bags. That gets brought over to the pharmacy staff. So pharmacy technicians and pharmacists who are staffing the event. And again, HIPAA, everything. And honestly, these events are so busy that we're looking at the names of the medications and then just trying to classify them from there. No one there has to be no worry at all about the information that's left on the vials.
Oh, perfect. And so for more information about the Drug Take Back event, you can visit www.mamdp.com for the Drug Take Back event. So thanks to Joe, Lisa, and Tara for being with us today to talk about prescriptions and pharmacies here in Muskegon. Today's broadcast has been brought to you by Mercy Health Muskegon. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health.